Welcome back to Atlanta and Company. I'm Christine Pullara. Hey, do you have tired and achy legs? Well, VEINatlanta is offering a free leg screening for venous reflux disease. Here to tell us all about it is cardiovascular surgeon Dr. Prevosti. He's brought along with him Audra Edwards, a patient, and a technician, I said it right, and then the commercial break, Cioloca.
That's right.
Thank you, thank you. All right. Well, thank you all for being here. And Audra, let's talk to you first and foremost. When did you discover you were having problems with your legs, and how bad was it?
Well, unfortunately, it's hereditary, so I knew that that could be a possibility. And at first, it was unsightly spider veins.
Yes.
But then in my 30s, I really started to hurt and ache and just feel tired, especially when exercising.
Right. Do you ever have itching? Because mine seem to itch. I don't know.
Sometimes.
Like just tired, achy, itchy. My mom has bad veins, unfortunately so, and I've already started with the spider veins too. And it seems like as you age, it all just comes up and makes it even worse. So how did the doctor help?
Well, he did at first the ultrasound, which I thought was amazing because I've had sclerotherapy done throughout the years, and I've never had a doctor ultrasound me. In fact, I never even met some doctors at some places. It was just the people that worked for him.
Really?
And so I was really impressed with his proactive approach to get to the root cause of it, which in turn I think helps not to have the spider veins, the visual stuff. And so I started with the ablations because I have very incompetent legs, evidently, from hereditary. We started with the ablations and different closures, the laser, and the radio frequency.
Wow.
And we're doing ultrastatic sclerotherapy too, and then I'll start with the cosmetic stuff.
Wow, fantastic. So you went to that first free screening, and what was that like? Because there are people out there, like myself, who are thinking, this is a problem, and right now, luckily, it's not so much medically, it's more cosmetically. I don't like the way I'm looking in shorts or skirts in the summer. So you went to that first screening, and how did it help?
I was just really impressed at first because the detail. They did the ultrasound, and Dr. Prevosti talked to me about something that I didn't even know was possible, that my legs would not be tired anymore, especially playing tennis or running. And another thing I didn't even think would happen is my legs don't feel as heavy anymore.
Right.
So I feel I can run those extra miles and go that extra set.
And then that just helps you feel more healthy. You're staying active, which is just going to be better overall. And doctor, talk to me about what the technician OV is going to be doing so we can get a better idea of what we can do when we come out for the screening.
Sure, Christine. What we'd like to do here is demonstrate a little bit what an ultrasound looks like. And this is a vascular ultrasound, and we're focusing on the venous anatomy. Now you have to remember that Audra has already been fully treated, so what we're going to see are treated veins, which are veins that are already closed down. But as you can see, we use registered, certified ultrasound technologists, and we use the latest, highest quality ultrasound machines. And what happens is this ultrasound probe that you see OV holding here with some gel goes on the area that we're looking at.
Sure.
And then that probe delivers an image onto the screen of the ultrasound machine. And this is how we detect problems with veins. Now I know this all looks like little squiggly lines to you, but to a trained eye like OV, he can detect where the veins are. He can detect by the different color that you see. Sometimes we see some blue color, sometimes we see some red color, and that determines whether the veins are working properly or not. We also use the ultrasound to determine if somebody has a blood clot, which can be a dangerous condition. And we use the ultrasound when we're doing our treatment as well. We use it to guide the special catheters.
Sure.
But the thing is, it's painless. And it is very accurate in determining venous disorders.
Okay, so in terms of Audra's legs right now, what you saw was good, right? Because we didn't see any red or blue. So that showed that, as you said, the veins are closed and all is right. And by the way, your legs look great. I didn't see any before shots, but they look fantastic. They look healthy, and as you said, it's enabling you to be more active, which is huge because it's almost like what came first, the chicken or the egg? When your veins aren't healthy, then you're not being active, and you might put on weight, and it just becomes a vicious cycle.
And Christine, Audra's story is very representative of a lot of patients that we see. Initially, it might be some spider veins that comes to their attention, but then they realize that they're when we ask them that their legs do ache and that one leg is more tired than the other. And then, yes, and then their mom had problem with veins.
Right.
Or when they were pregnant, the veins came out. And then they recede, typically they recede, but the patients sometimes are left with a tiredness and achiness. And a lot of patients just accept that, like, oh, well, I'm getting a little bit older.
Right.
But what they don't realize is that pain can be taken care of and can go away.
Excellent.
And that patients can get healthy legs again. Okay,
good. And when we come in and come to this free screening, what do we need to bring? Any kind of documentation, or, you know, how can we be prepared to come see you?
You don't need any documentation. If you'd like, you can bring some shorts. Of course, we have plenty of shorts in the office. But if you have a pair of gym shorts that you want to bring, because we do examine you and do the ultrasound in shorts.
Sure.
But the initial screen takes about 15 minutes. We do go through a brief history. We do ask some questions. I do a brief physical examination, and then we do some education. I have a chart of the veins on the wall in the different exam rooms, and we go over the findings. And then from there, I can tell the patient whether their condition is related to vein problem and what kind of things we can do to take it from there.
Fantastic. And Audra, you know, you mentioned going to see other specialists, but that you really didn't feel and get the results before the doctor. So, you know, what would you say to anyone out there who's thinking, you know, hey, I don't know, I've been there, done that, and it just is what it is?
He was proactive. He took the proactive approach, which is going to be the domino effect, where you're not going to have more spider webs and the unsightly cosmetic things if you take care of the root cause.
Right.
And Dr. Prevosti took the time, and he has an incredible bedside manner.
Right.
And I saw him on your show, so I'm very thankful for that.
Yes. Excellent. Good job, Doctor. Well, thank you all for being here. We really appreciate it. You have the opportunity now to get the help that Audra did. All you have to do is go to the free screening, and there are several of them. They're February 20th from 8 to 5, February 21st from 8 to 7, and February 25th from 9 till 1. But you have to call to make an appointment. The spaces are filling up as we speak, I'm sure, and that number is 404-446-2800, and all the screenings will be held at Vein Atlanta Clinic at 1100 Johnson Ferry Road. Thank you so much for being here, all of you. We really appreciate it. And Audra, thanks for showing off your sexy jams. I know that's not always easy on TV.
Only if it helps one person, right?
Yeah, exactly, and it probably will, more than one. And for more information about Vein Atlanta, visit their website at veinatlanta.com.